This is ultrasound case review. Today's case is intramuscular lipoma. We'll see the ultrasound findings and then we'll discuss the case. So first, the clinical details of the patient. He was a 30-year-old male patient coming with swelling over the thigh. There was vague pain over the swelling. Next step was investigating him with ultrasound soft tissue. So here we find the lesion, which is intramuscular, and it shows a clear-cut margin from the adjacent muscle parenchyma. So relatively there's a well-defined margin of the lesion with adjacent muscle, and the echogenicity is hyperechoic, and this is the adjacent muscle which is slightly hypoechoic. Here above this we can see the fascia and subcutaneous tissue which is normal. And what we see here is the hypoechoic muscle with fibrillar pattern, normal muscle. So once we measured the lesion, it was 5.9 into 2.3 centimeter lesion, which was hyperechoic in appearance with a relatively well-defined margin from the adjacent muscle, and it had linear hyperechoic bands within. No color flow was seen on Doppler, and adjacent muscle appeared normal. Also no calcification was seen. Here's the lesion. So the diagnosis, we diagnosed it as intramuscular lipoma. These constitute 1% of all the lipomas, and there are two subtypes. One is circumscribed, one is infiltrative. So the symptoms commonly include a swelling and sometimes rarely present as paresthesia of the region. Large muscles of limbs are the most common site. Next is the trunk. So on ultrasound, these appear as hyperechoic lesions. They can also be iso or hypoechoic, hyperechoic being more common. They are well defined in case of circumscribed ones. They have this striated appearance as in our case. They have no acoustic shadowing and no or minimal color flow on Doppler. If they have some color flow or more color flow on Doppler, then these are going for cancerous change. So this is a typical appearance of intramuscular well defined or circumscribed lipoma, as in our case we saw. Other subtype is the infiltrative type, where we can't see well defined margins. On X-rays, these are not very well seen, and if they are large lesions, then they can be appreciated as lucencies. On CT, here we have an intramuscular lipoma in chest wall muscles, which appear hypodense and shows fat attenuation, which comes in negative Hounsfield units. On MRI, here we can see upper limb intramuscular lipoma, which is iso-intense to subcutaneous fat on all sequences. So on T1 and T2 weighted, it appears hyper intense as equal to subcutaneous fat, and there will be suppression on fat suppressed sequences. Treatment of intramuscular lipomas, conservative wait and watch will be done, and wide resection can be done if the patients are asymptomatic. Like, share and subscribe our channel on YouTube and Instagram, Radiology Doodles, for more such videos. Comment down if you want any videos on any topics. Thank you.